the purple one, 100 millimeters. About the right size, right? So that's about the right size. Corner of the mouth down to the meatus of the ear. So we put these in two different ways you can put these in. One, as we said, is using a tongue blade, depressing this, and can I borrow your pen?
You'd come in handy.
There you go. So this would be that, and really you're going to be at the head of the bed doing this a lot of the time. Tongue blade in your left hand, pushing down, make sure you don't pinch anything, and sliding this right over the tip of your pen/tongue blade. In, should be just like that. Again, this will not be tolerated well in an awake patient. So don't place them in an awake patient. If you've given a very light dose of your IV anesthetic, your patient may be waking up by the time you're starting to place this in. So I guess what I'm saying is give more drug before you place these in. Very good devices to have. Now, these are also really great, especially in your patient that may be waking up. These are nice when you're sending your patient to the PACU, right? It's a bigger fellow that needs this, has obstructions, put an MPA in. You guys all place these? Kind of not really. So once a lot of problems, Shirley, especially if you haven't done this, is people try to go up like this, like you're going into the nose. Absolute wrong way to do it. Do not do it this way. Best way is to go straight perpendicular in, just like this, straight down. Okay? If you hit some type of resistance, don't do it. But remember, we say perpendicular, we're talking directly to this face. It's going to go perpendicular to that. Do not go in like this. This is a way to. What's up there?
Brain.
Brain, yeah. Hopefully we don't hit that. If we have a basal skull fracture, not going to do that. But just all your, this gets you more into the septum, the turbinates, the concha, and all that, and just hitting tissue. We don't want to do that. Just straight down. What were you going to say? This guy has a little piece of skin there, but do what?
I'm just gonna make a.
These are tolerated in awake patients, and this helps move all that tissue. These are great devices. Adjuncts to use. Pretty straightforward. Interincisor gap, we talked about right here. You're going to have basically your canines, right? You want to see if they have 3 fingers. Everyone open your mouth. Pretty wide, right? Kind of hurts your jaw. But all of you should be able to do that. For a Malampati, another one to do is, we didn't talk about this, but can you bite your vermilion border here? Can you do that? That's another thing. And what that's doing is protrusion of the mandible. So it lets me know when this patient is asleep and I come back down here to the angle of the mandible, try to elevate that, can I displace that? Because if I can move the mandible forward, where is the insertion point of the tongue? Or the origin, it's up here, right? So if I can pull that forward, I can move that tongue out of my oropharyngeal cavity. Malampati score, again, we talked about that. The right way to do that, patient sitting up in the bed. We don't want them laying down. We don't want them at 30 degrees. We want them sitting exactly up or standing. Open their mouth.
That's when you take your history, when you do go take your history just to...
So when your whole airway exam, that whole comprehensive thing is first going to be the history and all of that, and then looking at the patient, all that. Then your physical assessment, that's where you're going to get that Malampati score and all that. So what I would do if I was going to do this on you, I would say, hi, Levue, my name is Joe Martin. I'm a CR and AMD anesthesia today. Nice to meet you, and I'd ask you all those questions. Do me a favor. Can you put 3 fingers in your mouth? And most of the time they're like, what? Show them. Okay, great. Can you bite your upper leg? Good. You put your chin in your chest, extend your head back, look left, look right. I've done my range of motion. Great. I'm going to have you look up to the ceiling, place my fingers on your, right there. It's got about 4 fingers. See the tip to there? So you know he doesn't have any microanthia going on. What I want you to do is open your mouth real wide, stick your tongue out, don't make any sound. Good, so I can see the uvula. Go ahead, keep it open. Uvula, stay right like this. Don't do any of this. So it's important that just like that. You can see both pillars. Excellent.
But is that mouth floor of the mouth gonna, raise up?
When you move and you try to phonate, it does.
Okay.
That's why you have to just stay straight up, no phonation, open, tongue out. Exactly. What else am I missing? I think that's it. Oh, loose or missing teeth. You have any loose or missing teeth?
No.
Great. And that's about it. Took what, 2 minutes? And that right there just saved up. That didn't even take 2 minutes. That saved a lot of progress. I don't know right now. I'm not worried I mean, I'm gonna do my circuit suction ambu bag present and that whole ambu bag. I'm gonna think through. I have my.
Oh, do this?
Okay, you do that. Yeah. Do you breathe better through one nose?
No.
That's fine.
There you go.
But with what I just saw right there, I mean, I know you're gonna be okay.
Yeah.
That's about it, right? Yeah, that's about it. That right there is gonna save you a lot of problems, or avoid potential disaster when you're actually doing induction, okay? I think that's about that for that. Do you have your other sheet?